When they boost your copay, don't you know what to say?
More to do. Good afternoon, everyone. My name is David Campos, and I have the honor of representing this neighborhood, the Mission, along with Bernal Heights, St. Mary's Park, and the Portola on the Board of Supervisors. It's great to see Miranda. Miranda, I think I have seen you at many different events already, so she's an old pro activist. So, they start early in San Francisco, which is a wonderful, wonderful thing. I think it's really appropriate that we're here at the Eric Casada Center. I always want to remember my friend Eric Casada because he was a true champion for social justice. And in the end, when we talk about single payer, when we talk about what's happening with the Health Care Security Ordinance, we are really talking about a very basic social justice issue. The reality is that what we're about, I think it's collectively this group of people that are here in this room and who have been fighting for single payer, is the idea that healthcare is not a privilege, but that healthcare is a very basic human right. And I think that in San Francisco, we have been lucky that we've had the leadership of people like Tom Amiano and a very broad coalition that ultimately got City Hall to do the right thing and have universal health care in San Francisco. And Paul Kumar, who you're going to hear from, is a key critical player in that effort. Paul is as knowledgeable about healthcare as they come, and he can give you more specifics about the behind the scenes, how the fight for universal healthcare came into being, and the technical challenges that we face today. But the long and short of it is this, that the moment that Amiano proposed universal healthcare in San Francisco, the business community, and by that I mean mainly the Chamber of Commerce, Golden Gate Restaurants Association, has been trying to find a way to either stop it, and once it went through, to find ways of finding loopholes and then taking advantage of those loopholes. And even though San Francisco has become a model for the rest of the country, when I was elected supervisor in 2008, the issue that became very much a central focus of a political fight in City Hall was the issue of a loophole that we learned about from workers, mainly workers in restaurants, who were pointing out that even though the Health Care Security Ordinance requires that a worker in these businesses that has 20 employees or more provide health care to their workers, that they in fact were not getting health care. So when we looked into that issue, and just you have to understand there are three ways in which employers in San Francisco can meet their obligations under the Health Care Security Ordinance. The ideal one, which most of them use, is that they buy insurance for their worker, and we want that to happen. They also can use Healthy San Francisco, and that's where the brilliance of folks like Amiano, Kumar, and others, where the city has its own plan, which is actually subsidized. And then a third way is that they can use what are called health reimbursement accounts. Only a small percentage of businesses actually use health reimbursement accounts. Many of them happen to be restaurants. And the way that it works is that, I'm sure that most of you who have gone to a restaurant have seen that when you go to a restaurant, you get a bill, and on the bill you usually see a surcharge of 3-4% depending on the restaurant. In 2010, businesses, mostly restaurants, collected about $62 million from people like you and I, consumers, supposedly to provide health care to their workers. It turns out that of the $62 million collected, they only spent $12 million on health care. The remaining 80% or $50 million, lo and behold, was pocketed back by these businesses. And so we have, I guess, in the eyes of the chamber, the radical idea that we would clarify the law so that where the law says that you're supposed to spend money on healthcare, spend means spend, not just creating an account, setting it aside, and then pocketing it back. At that point, the Chamber of Commerce came out against that legislation, arguing that we were taking $50 million out of the pockets of businesses, out of the local economy. Of course, we correctly noted that in fact the $50 million was never money that belonged to businesses, but actually was paid for by consumers for the purpose of healthcare. And that in fact, consumers were being asked to pay twice, not only as a consumer, a customer of a restaurant, but also as a taxpayer, because when that worker and her family cannot access healthcare, they go to the ER, and you and I, as taxpayers in the city, foot the bill. It's also an issue of fairness because the vast majority of businesses actually not only follow the letter, but the spirit of the law, and actually provide insurance, participate in Healthy San Francisco, or actually allow their employees to use the health reimbursement accounts. And the health reimbursement accounts are something where many employees did not know about them, and even those who knew about the health reimbursement account, there were crazy limitations that prevented them from using the money that was in these accounts. Limitations like you can't use it to buy health insurance, you can't use it for dental, you can't use it for vision, things that completely go against the idea of why you have this coverage. The long and short of it is that this legislation that we introduced passed, but it was vetoed by Mayor Lee. And then there were people on the Board of Supervisors, including original co-sponsors of the legislation like Supervisor Cohen, Supervisor David Chu, who sided with the mayor and passed a watered-down version of the legislation that essentially that does not require that the money be spent. It has general language that it should be spent, and it requires that they hold on to it for 2 years, but what we always said would happen has indeed happened, that the problem remains, that businesses continue to collect money, that's not being used for purposes of healthcare, and the rate at which the money is spent on healthcare remains. The difference is that instead of collecting $62 million a year, they're collecting tens of millions more. So it's become a larger issue. In the last few months, as the Affordable Care Act has been coming into implementation, we started to hear from the Chamber of Commerce and the Golden Gate Restaurants Association a push to undo the Health Care Security Ordinance. No one really came out and said it, but the idea was now that we have the Affordable Care Act, we don't really need the Health Care Security Ordinance. And so our coalition began to work very hard to make sure that we push back against that, because we have always understood that as great as the Affordable Care Act, as important a step as it is, there are many loopholes that remain in the Affordable Care Act. And those of us who want single payer understand that anything short of single payer is not going to get you to where you need to be. We were successful in our efforts to push back as they were trying to undo the Health Care Security Ordinance, and specifically they were trying to undo the employer spending requirement, which in San Francisco means that there is more coverage, because at this national level, the threshold for what businesses are covered is 50 employees. In San Francisco, it's 20. In San Francisco, because of the Health Care Security Ordinance, you're not going to see some of the problems that you're going to see in other parts of the country, where under the Affordable Care Act, you're only covered as an employee if you work 30 hours or more. So you see the situation in many jurisdictions where employers are cutting hours to below 30 hours a week so that they don't have to pay for that person's health care. In San Francisco, we don't have that issue. But today, there is an issue that remains an issue, because the loophole that we talked about, the loophole that was the focal point of the political battle a few years ago, not only is it a bigger issue, but it's an issue that is going to become an even bigger problem because of changes in federal regulation. What happens right now is that even though the health reimbursement account model still, does not allow for everyone to use that money, the rules under federal law are going to be such that the health reimbursement account is going to take a very different form, and instead of being a health reimbursement account, it's going to be what's called an accepted health reimbursement account, which will only be allowed to apply to ancillary services. What does that mean? That means that of the accounts right now in existence, 65% of them, the employer allows the worker to use that money to buy insurance. But under the new regulations, that will no longer be allowed, because buying insurance is not an ancillary service. So the money in those accounts can only be used for things that are, ancillary or not, focal to insurance. So things like glasses you can use, and so I tell people, you're going to have a situation where people are going to be able to have some really nice looking glasses, but they're not going to be able to have access to primary care. And so because of that, we are fighting right now to make sure that we close that loophole. And I think that it is really part and parcel of the larger discussion that's going on in San Francisco, where we have an affordability crisis in the city, where we have displacement of not just low income, but of middle income and even upper middle income individuals. And it's not just housing that makes the city unaffordable. An important component of affordability is that people have access to this very basic right. And there are still thousands of employees who don't have that, and thousands that in fact do have access, even under the flawed law that we have in place. They're not going to be able to continue to have that access unless we act now and close that loophole, which is really what we are focusing on right now. And that's where folks like you come in, because for this loophole to be closed, it's going to take a groundswell. It's going to take people, San Franciscans of all walks of life, saying, we believe that healthcare is a right, and as much as we have come very far, we still have some ways to go. And thank God for Tom Amiano, because Tom Amiano continues to push for making sure that we not only follow the letter, but the spirit of the Health Care Security Ordinance. He recently talked about another problem with the Health Care Security Ordinance, which is the fact that even though we have people that will be eligible for the Affordable Care Act, that for many still, healthcare will remain out of reach because it will remain unaffordable. And that's why closing this loophole is part of that solution, because the loophole, by virtue of having employees able to access this money, they can use that money to actually subsidize what they get from the federal government and actually buy insurance. But what Amiano has recently been talking about is the fact that there will be people who are currently in Healthy San Francisco who will be kicked out of Healthy San Francisco because they qualify for the Affordable Care Act, but will not be able to benefit from the Affordable Care Act or enroll in the Affordable Care Act because healthcare is so expensive. And Amiano, I think, rightly points out that the spirit of the Health Care Security Ordinance was to help people who, for whatever reason, are not able to afford something like that. And so that's what he's pushing for. And the health department recently created a moratorium so that they're not going to kick people out of Healthy San Francisco until we figure out a reasonable set of rules that address the issue and allow people who are not able to afford healthcare to remain in the system. So that's where we are in San Francisco. As far as we have come, we still have some ways to go. And so I'm really honored and proud to have the opportunity to talk to you about this. The last piece that I would say is that I think it's not just what happens in San Francisco, but it's also what happens in Sacramento. And we need to make sure that we have the same vigilance that we have at the local level, at the state level, as the ACA is being implemented. Because as of today, there are millions of people who are going to be left behind. And I know that, for instance, in one of the communities that I represent, that I'm a part of, the Spanish-speaking community. Many of these individuals are being left behind. We are not doing a good enough job of doing outreach to them, which is why we need to push our local, but also our state government to reach out to these individuals.